Hi, good evening. My name is Sergeant Garcia. This evening I'll be giving you a persuasive speech on the need for cardiopulmonary response and first aid. What we're going to discuss is some signs and symptoms of heart attack, stroke, and cardiac arrest, and the need for CPR. Heart attack, coronary heart disease is the #1 cause of death in the United States. Stroke is the #3 cause of death in the United States and a leading cause of serious disability. That's why it's so important to reduce your risk factors, knowing the warning signs, and know how to respond quickly and properly if warning signs occur. All right, you got your three basic emergencies. You have heart attack. A heart attack is your heart actually dying. Okay, some signs and symptoms are chest discomfort in your upper body, and shortness of breath. Okay, a lot of people assume that a shortness of breath, especially after they eat or something, is caused by like indigestion and stuff like that. So they delay the treatment for it or delay reporting. They've actually had a heart attack and actually get to the hospital 30, 40 minutes after the onset of signs and symptoms because it doesn't go away. Okay, that's a long time to wait. Some other diseases we're talking about is stroke. Stroke is a medical emergency also. Some warning signs of a stroke are sudden numbness and weakness of the face, arm, or legs, especially in one side of the body. Sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, and sudden trouble walking, dizziness, loss of balance, or coordination. A stroke is actually a mini aneurysm in your brain. What happens is the vessel in your brain actually can rupture, and the blood kind of forces out into the surrounding tissue of the brain. What happens is that tissue doesn't really need the blood, it needs the glucose that's in your blood to survive. When the blood gets there, it actually starts eating away and destroying the brain cells and brain tissue. Well, when you have a death of a brain cell, brain tissue, is when you have all those other signs and symptoms. The numbness or weakness is usually is always on the affected side. So if my right side is affected, it's actually on my opposite side. So if my left part of my body goes numb, the actual stroke is going to be happening on the right side, okay, and vice versa. Trouble seeing in one or both eyes, sudden trouble, dizziness, loss of coordination and balance. That again goes back to whatever side you're actually being affected by the stroke. Cardiac arrest. Cardiac arrest is actually when your heart stops. It's a very, very quick thing, or it could be over a period of time where your body is kind of adjusting and then actually goes into cardiac arrest. It's a sudden stop of responsiveness and no normal breathing. Some heart attacks are sudden and intense, the movie heart attack, where no one doubts what's happening. The guy clutches his chest, falls to the floor, and you know what's going on. Usually it's an older male. Males have a higher tendency for heart attack. Chest discomfort. Most heart attacks involve discomforts in the center of the chest that lasts more than a few minutes, where that goes away and comes back. Shortness of breath with or without chest discomfort, and it may include breakdown in cold sweat, nausea, or lightheadedness. Again, this goes back to the cardiac. If your heart's dying, it's not pumping the oxygen that you need, so you go through the signs and symptoms of basically lack of oxygen. Some stroke warning signs we've talked about was just, sudden numbness or weakness in the face or body, sudden confusion, trouble seeing in one or both eyes, dizziness, walking, loss of balance or coordination, and sudden severe headache with no known cause. Okay, if that happens to somebody, then you can suspect a stroke. Cardiac arrest strikes immediately without warning. Here are the signs: sudden loss of responsiveness, no normal breathing. If the person goes a long time while he's in cardiac arrest without being resuscitated either through CPR or through an AED, which is automatic electrical defibrillator, then that person will die. Cardiac arrest is a medical emergency. You need to get them to treatment soon. Today we discussed the warning signs and symptoms of a heart attack, stroke, and cardiac arrest. Today, heart attack and stroke victims can benefit from new medications and treatment unavailable to patients in past years. For example, clot-busting drugs can stop some heart attacks and strokes in progress, reducing disability and saving lives. But to be effective, these drugs must be given relatively quickly after heart attack or stroke symptoms first appear. Usually it's within 30 minutes, okay? That's why it's very important for you to get that person to aid, because if you don't, they delay treatment and it makes the outcome a lot worse. If you or someone with you who has one or more of the signs or symptoms of either heart attack, stroke, or cardiac arrest, you need to seek medical emergency. Activate EMS, 911. Also, check the time so you know when the first signs and symptoms occur. It's very important when you go to the emergency room or wherever you're taking this person for treatment that they know when the signs and symptoms occur. If given within 3 hours of the start of symptoms, a clot-busting drug called tissue plasminogen activator, TPA, can reduce long-term disability for the most common type of strokes. TPA is the only FDA-approved medication for the treatment of strokes within 3 hours of stroke onset symptoms. Heart attack and stroke are life and death emergencies. Every second counts. If you see or have any of these signs and symptoms listed, immediately call 911. Not all these signs occur in every heart attack or stroke. Sometimes they go and return. If some occur, get help fast. Again, what we discussed was some signs and symptoms of heart attack, stroke, and cardiac arrest. Okay, that concludes my demonstration or my speech. Thank you for listening.